have you ever really stopped to think about who's responsible for your health? I mean, it seems like a pretty straightforward question, right? But the answer, well, it's this incredibly complex web. It involves you, your community, and systems that stretch all the way across the globe. So in this explainer, we're going to untangle that web one layer at a time.
Okay, so let's just dive right in. If you get sick, is it on you for not eating right? Or is it your doctor's fault for not catching it early? Or maybe, just maybe, it's the government's problem for not making sure the air is clean. The thing is, it's almost never that simple. Responsibility is shared, and it's shared in ways that might actually surprise you.
So here's how we're going to tackle this. Think of it like a series of expanding circles. We're going to start right at the very center. That's you, with individual responsibility, and then we'll work our way out to the community, then the state, and finally, the whole wide world.
All right, first up, the core. This is all about individual responsibility. Because, while we can say health is a fundamental human right, it's also something that needs our active help to protect and maintain. And that brings us to this really key idea, self-care.
So, what do we actually mean by self-care? It's not just about bubble baths and face masks, not in this context. We're talking about the whole collection of things that we, as individuals and as families, do to boost our own health, to prevent disease and, to get back on our feet when we're sick, all without a professional having to step in.
And this right here shows you what that looks like day to day. We're talking about those small, consistent choices, the food on your plate, how much sleep you get, something as simple as washing your hands. But it's also about being proactive, right? Getting those screenings and vaccinations and actually raising your hand when something doesn't feel right. These are the real building blocks of our health.
But, our individual efforts can only get us so far. We just don't exist in a bubble. So the very next layer of responsibility has to be our communities. This is where we shift our thinking from just me to we.
Now this is really interesting. What you're seeing here is a huge shift in thinking. We've moved on from this old school model where people were just passive targets for healthcare services. The new idea, the one that's really taking hold, is that people are active partners in their own health. It's health by the people, not just for the people.
And this isn't just some nice, fuzzy idea. It has a real impact. It starts with communities actually pooling their resources, building clinics or funding local health programs. Then they get a seat at the table to help decide how those services are going to be run. And the final piece, that's when people actively use these services to stay healthy in the first place.
I love this quote from Henry Sigarist. It just says it all, doesn't it? The war against disease is a people's war. Health isn't something that can just be handed down by experts. It takes a collective, grassroots effort from absolutely everyone.
Okay, let's zoom out to that next circle and see how all this builds into the formal role of the state. Because beyond what we do for ourselves and our neighbors, governments have a really fundamental duty to protect the health of their people.
And in a lot of countries, this isn't just a suggestion. It's literally written into the law. If we take Sudan's constitution as an example, the state makes a promise to protect its citizens' health, from making sure workplaces are safe to providing a safety net for the most vulnerable. It's like a formal social contract between a government and its people. These national promises are also tied into a much bigger global conversation. I mean, look at this timeline. From the big focus on primary care way back in 1978, all the way to the super broad sustainable development goals of today, the world has come together again and again to say, yes, health is a shared global priority.
And for our final layer, we have to zoom out as far as we can. Because, let's be honest, in our world today, diseases don't care about borders. And that means a lot of our biggest health fights demand global teamwork.
This kind of international cooperation, often led by groups like the World Health Organization, is just absolutely crucial. It's how we share expertise, how we get life-saving drugs to where they need to go, how we coordinate a response to a pandemic, and how we unite for these massive campaigns like wiping out smallpox and polio.
So there you have it, this perfect model, right? 4 layers of responsibility, all working in harmony. But, theory is one thing. Reality can be messier. So let's take a look at what happens when gaps start to show up in this system. A good way to see this is by looking at urbanization.
We are quickly becoming an urban planet. But as you can see from this chart, that shift is happening really unevenly. More developed countries are overwhelmingly urban, while the least developed are still mostly rural. And that difference isn't just about where people live, it creates totally different health challenges and opportunities. And here is the single most important point.
Those big national averages, they can be so misleading because they often hide these massive, massive gaps that exist inside a single city, where the richest and the poorest people are basically living in two different worlds when it comes to their health.
Just look at this data from Delhi. It's just staggering. We're looking at the rate of skilled birth attendance. For the wealthiest women in the city, it's pretty much 100%. For the poorest women, it's down at 19%. That gap is way bigger than the gap between the national urban average and the rural one. This is a clear case of a system failing its most vulnerable people. And that brings us right back to where we started. Health is everyone's responsibility, no doubt, from our own daily choices all the way up to the global policies that shape our lives. But when you see a gap as massive as the one in Delhi, it forces us to ask the most critical question of all. If responsibility is shared, where does accountability lie? Who do we hold responsible when the system fails the very people it's supposed to be protecting? Answering that is probably the biggest health challenge of all.